So the lady's driving along, not suspecting anything, and all of a sudden she hears a sharp screech behind her, of which the person usually tenses up and maybe looks over their right shoulder or something and can cause splintering of that muscle group looking in that area. As she gets hit from behind, her head automatically goes back. This is what we call an accelerated auto injury, where she's compressing the cervical spine here. And immediately after that, the head goes snapping forward into hyperflexion. After the car maybe hits the car in front of her, slows down, hits something else. And not feeling too good afterwards. Looking closer at the spine, if we had X-ray eyes, this is what we'd probably see: a nice cervical spine here, a nice curve, with normal vertebral positioning, intact ligaments, and normal nerve conductance going in and out of the holes to the spinal cord. After she gets hit from behind, these vertebrae here get slipped backwards. And that puts pressure on these nerves, which causes pain. Also, there's stretching of these ligaments going from vertebrae to vertebrae that contain the disc, and that causes strain of these ligaments here. As the person goes the opposite direction, you have the stretching of the posterior ligaments between the vertebrae in the back there. And these are ligaments, and the back of the disc can be stretched that way, perhaps at a different level than the first one. And correspondingly, you have swollen, irritated nerves of both the first impact and the second impact. As a consequence, what happens is, instead of having that nice curve, you've got a scoliotic curve, a hypo-lordotic curve, so to speak, that causes a lot of pain in the individual. And these bones need to be put back into alignment as soon as possible. The swelling needs to be taken down. This neck doesn't have the strength that it did before to hold the head up, which is about 10 pounds. You have swollen discs, misaligned vertebrae, and stretched ligaments, all that need attention.